Hello and welcome to the COVID Safety for Schools primer. This video is a condensed version of the full COVID Safety for Schools course, which is also freely available to school staff and parents via the covidsafetyforschools.org website. My name is Colin Kinner, and I'll be leading you through this video in which we'll cover a range of topics relevant to keeping students and staff safe during the ongoing pandemic. In the next 90 minutes, we're going to cover COVID facts and figures, discuss the known short-term and long-term health risks from COVID, address some common myths and misunderstandings, discuss how COVID spreads, and of course cover practical steps that schools can take to minimize the risk of COVID spreading. When you've completed this primer, you're welcome to go on and do the full course, which also features modules delivered by some of Australia's most experienced doctors and scientists with expertise relevant to COVID, including in emergency medicine, infectious diseases, epidemiology, infection control, and public health. Both the full course and this primer video have been created with the involvement of this group of medical and scientific experts, as well as principals and teachers who've implemented COVID-safe measures in their own schools. Our aim with this video is to give schools factually accurate information about COVID informed by the latest science. If you're a principal or a teacher, we want you to be confident that you have the right information to help you minimize health risks from COVID without disrupting the core role of your school. If you're a parent, we also want you to have access to the best possible information, and I'm sure you'll find some useful tips about how to keep your own family safe. Before we get going, I should introduce myself. I'm an experienced science communicator and public health advocate. I've spent more than 20 years working with scientists and engineers, helping them to communicate the impact of their research. Since the beginning of the pandemic, I've been involved in a range of projects focused on COVID. I've read a lot of the research that's been published, and I've written several articles analysing Australia's public health response. I'm a member of the independent pandemic advisory group AusSage, a member of COVID Safe Schools, non-executive director of the Safer Air Project, and founder of the Clean Air Accelerator. I'm also a parent, and like all parents, I want my child to get the best possible education and at the same time to be as safe as possible at school. A couple of important points. Firstly, this video is for school staff and for parents. It's not intended for kids. Nothing in this video is intended as medical advice, and as always, you should talk to your doctor if you have any specific medical questions or concerns. Lastly, some of the information we'll cover in this video may challenge your understanding of COVID. I'd encourage you to keep an open mind and be prepared to re-evaluate what you know about COVID in light of the latest science. By using the information covered in this video, you'll be better prepared to prevent COVID spreading at your school, and by doing so, you could reduce the risk to members of your school community of becoming seriously ill, of dying or developing long COVID, or suffering any of the other long-term health impacts that we now know can follow a COVID infection. So thank you for investing your time in watching this video. Let's get underway. We're going to start by covering some basics of what COVID is and the impact that it's had since the beginning of the pandemic in late 2019. We'll start with some terminology. COVID is caused by the SARS-CoV-2 virus. SARS-CoV-2 stands for Severe Acute Respiratory Syndrome Coronavirus 2. And this is the virus that causes COVID-19, which is of course short for Coronavirus Disease 2019. We'll just refer to it as COVID for simplicity throughout the remainder of the video. COVID is an epidemic disease. This means that it comes in waves, with each wave being caused by the emergence of one or more new variants or subvariants. As you can see in this chart, COVID has caused 10 waves so far in Australia. The first 3 of those were the ancestral Alpha and Delta variants, and since then the Omicron variant, of which there have been multiple subvariants, and we'll talk some more about those in a minute. You'll notice in this chart that very early in the pandemic we saw peaks, which were then followed by periods of almost 0 cases. What we're seeing now is a very different pattern, which is a constantly high level of COVID at all times, with waves on top of that. Each of these waves represents the emergence of one or more new Omicron subvariants, starting with BA1, BA2, BA5, and so on. And in the more recent waves, what we've seen is a combination of multiple subvariants circulating at once. Having multiple subvariants emerging means that people are getting infected with one subvariant and then getting reinfected with a different subvariant within a short period of time, sometimes only a matter of a few months. This is happening because there's very limited cross-immunity from one variant to the next. This is a major factor in why we have ongoing spread of COVID globally, and it's why people are getting reinfected often multiple times a year. You'll notice that I've used a chart here that shows hospitalizations rather than case numbers. The reality is that in Australia, like in many other countries, very few people are testing when they have COVID symptoms, and for the most part, governments have stopped capturing positive test results. So official case numbers are now meaningless as a measure of how much COVID there is in the community, which is why we tend to look at charts like hospitalizations and deaths, because those numbers are a lot more robust. In the most recent Omicron waves we've had in Australia during 2023 and 24, it's estimated by the Federal Department of Health and Barnett Institute that somewhere between 3 and 5 million people are being infected in each wave. If we take an average figure of 4 million, that's the equivalent of 40 MCGs full of people getting infected in each wave. Australia has had 10 waves so far, and there's no sign of COVID waves becoming less frequent or infecting fewer people. If anything, what we're seeing is each new subvariant becoming more infectious than the previous. We know for a fact that most Australians have had COVID. There have been several serology studies looking at blood tests from people to find out whether they have the COVID-specific antibodies, and the results of those serology studies is that by December 2022, between 85 and 90% of the Australian population had been infected with COVID at least once. And of course, many of us know people who've been infected 3 or 4 or even more times. And just to note as we go through the course, you'll see references to published papers or research studies that you might be interested in reading. You'll see that they're denoted by the light blue background, and there'll be links through to the studies provided below. We know for a fact that COVID is one of the most contagious viruses that humans have ever encountered. Infection, or transmission as it's often referred to, can occur in as little as a few seconds, and we know that one infectious person can spread COVID to many others, and that infection can occur at close range, over long distances, and even after the infectious person has left the room. We also know that a large proportion of all COVID cases originate in schools, which shouldn't be surprising because schools are a place where we get large numbers of people in close proximity for long periods of time, mostly in shared indoor spaces. I'll refer here to a study that was published in a peer-reviewed journal in mid-2023 and is based on research done in the US that looked at 850,000 households. And this study found that in 70% of families that had had a COVID case in the family, the virus was introduced to the household via a school-aged child. This study also found that infection rates were higher during school term and lower during school breaks, which reinforces that infections acquired at school are driving waves of infection in the wider community. Something else that we know about COVID is that around a third of all people who get infected don't go on to develop any symptoms at all. We call them asymptomatic. And we also know that kids are more likely than adults to have entirely asymptomatic infections. Importantly, people who have no symptoms or who have very mild symptoms are still infectious. Sometimes they're referred to as silent spreaders. And this is one of the reasons that we're still in a pandemic. We have a large proportion, a third of all people who get COVID, are still infectious but have no symptoms. And this means that they have no idea that they have COVID or that they're spreading it to others. We also know from studies that have looked at chains of transmission that a large proportion of COVID infections come from people who don't have symptoms. This can be broken down into two groups. The source of infection can be either pre-symptomatic or asymptomatic. This is a study published in 2021 that found that 35% of COVID infections came from people who were pre-symptomatic, which means that they will go on to develop symptoms, but they're currently asymptomatic, but still infectious. And 24% were from people who were completely asymptomatic, which means that they never had symptoms throughout the entire course of their infection, but they were still infectious and capable of spreading COVID to others. We know that the vast majority of the world's 8 billion people have been infected at least once. Sadly, we know that around 28 million people worldwide have died from COVID. It's been estimated that this equates to around 337 million life years lost because of the pandemic. To put that number of deaths in perspective, we've lost around 40 million people to HIV/AIDS, but that's happened over a period of around 4 decades. We also know from research done by several groups that around 400 million people worldwide are suffering from long COVID, and that number is likely growing because each reinfection brings with it an additional risk of developing long COVID. And we'll talk some more about the topic of long COVID shortly. Also, sadly, we know that around 7.5 million children worldwide have lost a parent or a caregiver to COVID since the beginning of the pandemic. If we look at figures for Australia, so far more than 25,000 people have died from COVID in Australia, It's estimated that around 1.3 million Australians are living with long COVID, and that this includes 55,000 children. And as at December 2022, 2,375 children had lost a parent or a caregiver to COVID. So far, we've only talked about hospitalizations and deaths from the acute phase of a COVID infection. These are the visible short-term impacts that we can easily see. But we now know that COVID can also cause a wide range of serious long-term or chronic health impacts that often aren't visible. And these include cardiovascular disease, neurological damage, impacts on the immune system, and long COVID. The reality is that for many people, the biggest health threat posed by COVID isn't the acute infection at all, but actually the risk of long-term harm. One of the reasons that we're talking about all of this is that schools have a really important role to play in breaking chains of transmission, and therefore saving lives and preventing the long-term consequences that can come from a COVID infection. The good news is that there's actually a lot that schools can do to prevent chains of transmission. And over the remainder of this video, we're going to talk about simple, cost-effective things that schools can do to keep staff and students as safe as possible and prevent infections that could lead to that student or staff member, a member of their family, or someone in the wider community becoming seriously ill or dying or suffering long-term health consequences as a result of a COVID infection acquired at school. Visually, we can think of this as an infected child bringing COVID home from school to a parent or a sibling or a grandparent. And we know that the risk of death from COVID increases with age and also with other health complications. So what we don't want to see is a student being infected and bringing that infection home and it leading to the death of a grandparent. We don't want to see parents then becoming infected and taking that infection to their workplace, or siblings becoming infected and bringing it back into another class in school, and for those chains of transmission to lead to deaths or serious health outcomes for any of those individuals. One thing we know about COVID from the substantial amount of research that's been done over the last few years is that COVID is a vascular disease. It enters the body via the respiratory tract, but once there, it targets a protein called ACE2 to enter your body's cells. ACE2 can be found on the surface of many different types of human cells, including those that line the inside of blood vessels, called endothelial cells. So despite the fact that COVID elicits respiratory symptoms in people when they initially get infected, we now know that it's a vascular disease and that it travels to all parts of the body using the ACE2 receptor. This is a study that was published in 2021, and even that early in the pandemic, it was becoming very clear that COVID increases the short-term risk of cardiovascular disease. It was a study conducted in Sweden, and it compared 87,000 people who had at that time been diagnosed with COVID against 350,000 people who hadn't been infected. And what it found was a substantial increase in the risk of heart attack and stroke because COVID triggers an exaggerated inflammatory response that makes blood clots more likely to occur. And so this study found that 1 week after a COVID infection, people had a 3 to 8 times increased risk of heart attack and a 3 to 6 times increased risk of stroke. We also know now that COVID increases the long-term risk of cardiovascular disease. And so this is a very important study that was published in the journal Nature in early 2022. And what this study found was a substantial increase in the risk of cardiovascular disease at 1 year after a COVID infection. And so the results of this study found that 1 year after a COVID infection, people had on average a 72% increased risk of heart failure, a 63% increased risk of heart attack, and a 52% increased risk of a stroke. If we look at Australia, we're arguably a year to 18 months behind the UK and the US and some other countries in terms of the progression of the pandemic, because Australia was successful for a fair period of time in keeping case numbers very low. Nevertheless, we're already starting to see an increase in the number of fatal heart attacks in Australia because of COVID. And so this is a report from Sydney Morning Herald, which reported on some research that showed a 17% increase in the number of ischemic heart attack deaths in Australia in 2022 compared to a normal year. Similarly, an article reported in ABC News noted that the Heart Foundation has asked the federal government to implement heart health checks for everyone who has had a COVID infection because of the link between COVID infection and cardiovascular disease and heart attack. So let's go on and talk about neurological impacts. The first thing I wanted to highlight was that we know now that COVID increases the risk of neurological disorders. This is a link to a study in 2022 in Nature Medicine, and this study found a 42% increase in the prevalence of any one of these neurological conditions. They include stroke, cognition and memory disorders, migraines, seizures, and mental health disorders. There's also been some research done looking at the connection between COVID infection and increased risk of Alzheimer's and Parkinson's disease. In this study, which analysed the health records of over half of the Danish population, the researchers found that those people who had tested positive for COVID were at an increased risk of Alzheimer's disease and Parkinson's disease. So this study found that following a COVID infection, there was a 3.5 times increase in the rate of Alzheimer's disease and a 2.6 times increase in Parkinson's disease. Another really interesting study that's been done looking at the effect of COVID on the brain is this study that was conducted by researchers in Brazil in 2022. They looked at people who had had a COVID infection and they compared them with people who had had no infection, and they gave them a task, which was to reproduce a complex image by hand drawing it. There was no time limit in this test, and ordinarily the expectation would be that the overwhelming majority of people can accurately reproduce the image. Typically it's between a 5 and an 8% failure rate. But in this case, what they found was that people who had COVID had a much higher rate of failure in this actually fairly simple task. What they found was that 1 in 4 people who had had COVID were unable to accurately reproduce this image. And using brain imaging, the research team found observable changes in the brains of these people who were studied. And they believe this is likely due to inflammation caused by their COVID infection. So the authors conclude in this paper that we can expect millions of people worldwide to potentially suffer from visio-constructive impairment after a COVID infection. Visuospatial ability is key to driving, planning, drawing, and locating oneself in space. So these are pretty significant cognitive deficits for 1 in 4 people who've had a COVID infection. Another study published in the Lancet Journal in January 2024 looked at the effect of COVID on processing speed. What the study found was that people who had had a COVID infection were more likely to have a severe cognitive slowing or cognitive impairment. In this study, 19% compared to 4% in the control group. And among people who were suffering from long COVID, more than 50% of them were experiencing severe cognitive slowing or cognitive impairment. And another study published in the New England Journal of Medicine in February 2024 that looked at the effect of COVID infection on cognitive abilities, in particular memory and executive functioning. It analysed 113,000 people who had previously had COVID and found that those who had been infected, including with the Omicron variant, had significant deficits in memory and executive task performance, equating to a drop in their IQ score of between 3 and 9 IQ points. The researchers also found that reinfection led to additional reductions in IQ score. The authors believe that with continued exposure to COVID, this will lead to millions of people worldwide developing a level of cognitive impairment that affects their ability to function independently. They concluded that given what we now know about the impact of even a mild COVID infection on the brain, we should view COVID as a disease that poses a serious risk to brain health. Let's look now at the immune system impacts from a COVID infection. We now know that a COVID infection causes damage to the immune system. This study, which was published in March 2023, looked at the effect of a COVID infection on T cells, so the CD8 plus T cell in particular. T cells are an important part of the body's immune system and its ability to identify and fight infection. And the researchers found in this study that the effect on this T-cell response was similar to the long-term immune system damage that we see in people who are suffering from HIV. Unfortunately, we're also seeing that COVID has an impact on type 1 diabetes. This study that was published in May of 2023 found that a COVID infection almost doubles the risk of type 1 diabetes in children. Diabetes is a pretty serious autoimmune disease. It typically requires lifelong insulin injections. It can lead to damage to the blood vessels, which can lead to heart disease, stroke, chronic kidney disease, doubling the risk of type 1 diabetes in children after one COVID infection is a really significant and concerning outcome. You might be aware that the federal government held an inquiry into long COVID and reinfection. It was a parliamentary inquiry, and it called for a large number of submissions, including from experts. And one of the submissions was from Professor Jeremy Nicholson, who's director of the Australian National Phenome Centre. Professor Nicholson gave some evidence to the inquiry, and in that he made some concerning remarks based on his research into the effect of COVID on children. And I'll just read out one part of that evidence. He said, although children generally only have a mild respiratory illness, metabolically they're very seriously ill. There's a possibility that we've created a new set of disease risks for our children, which might change their risk for almost anything, including changes in their life expectancy. Probably one of the most important pieces of research that's been done on COVID in the last few years has been looking at the impact of repeated infections or reinfections. And what we now know is that there is a cumulative impact and that each infection adds to people's risk of adverse health outcomes. This is a landmark study that was done in the US and published in the journal Nature Medicine. It looked at a total of 5.8 million people, around 440,000 who had had one COVID infection, around 40,000 who had had multiple COVID infections, and they compared these two groups with around 5.3 million people who hadn't had a COVID infection at all. And what the researchers found was that each reinfection further increases the risk of death, of hospitalization, and of other adverse health outcomes. So compared to people who had had just one infection, those who had had one or more reinfections had a 2 times increased risk of death, 3 times increased risk of hospitalization, 3 times increased risk of heart problems, and a 3 times increased risk of blood clotting. Reinfection increased these in the acute phase and for at least 6 months after reinfection. So these are persistent increased risks. The important point, I guess, here is that being reinfected with COVID is not good, and the risk increases with each reinfection. Even if you or someone in your family has been infected once or more than once, that doesn't mean you should give up. It's very much in your interest to avoid another infection because each reinfection further increases your risk of negative health outcomes. I'm just going to play this short 20-second video from Dr. Mike Ryan from the World Health Organization, just outlining some of these concerns around repeat infections and the health impacts.
Many people now are boasting about the fact I've had this 4 times. I wouldn't like to have COVID 4 times, and I do think there's some evidence to suggest that sequential COVID infections do result in higher risk of long-term, long COVID or cardiovascular and neurologic complications. You don't want to get this disease once if you can avoid it, and you don't want to get it 4 times for sure.
Let's move on now and talk about long COVID. As I mentioned before, the number of people worldwide that are living with long COVID is now estimated to be around 400 million. And in Australia, the estimates are that around 1.3 million people are suffering from long COVID, and that number includes around 55,000 children. There's been a lot written about long COVID and a lot of attention to it. So in the next few minutes, what we're going to do is to unpack what long COVID is, talk about some of the effects that it can have on people, and how we can minimize the risk of developing long COVID following a COVID infection. Long COVID is defined by the World Health Organization as the continuation or development of new symptoms 3 months after the initial SARS-CoV-2 infection, with these symptoms lasting for at least 2 months with no other explanation. The WHO notes that common symptoms of long COVID can include fatigue, shortness of breath, and cognitive dysfunction, spanning a range of severity from mild to extremely disabling, and also that there are over 200 different symptoms that have been reported by different people who are suffering from long COVID. We know from a lot of research that's been done around the world that long COVID can start weeks or even months after an apparent full recovery from the acute phase of a COVID infection. And so far, there are more than 200 symptoms that have been tracked that affect people across multiple different organ systems. And so there's a link to a paper here that was published in the journal Nature, looking at thousands of long COVID sufferers. And one of the important conclusions is that they believe that long COVID is a result of viral persistence, meaning that the COVID virus, even though people have apparently recovered from the acute phase of an infection, The virus is still present in their bodies in various organs, and it's this viral persistence that then leads to the emergence of long COVID. Some of the common symptoms associated with long COVID are fatigue, chest pain, heart palpitations, cognitive impairment, memory loss, disordered sleep, shortness of breath. There's a very long list. Unfortunately, what we're finding both with adults and kids is that long COVID is something that can persist for a significant period of time. And in this study, they classified long COVID as having at least one symptom that caused impairment to their normal function. And what the study found was that 12% of the children that had long COVID had this impairment at 3 months and at 6 months after their first infection. And that percentage increased to 16% for children who had a repeat infection, so not their first infection. Interestingly, the study also found that there was no difference in severity between the first and subsequent infections. And this is important because it means that becoming reinfected doesn't lead to milder and less concerning outcomes. The prevalence of long COVID was talked about recently by the World Health Organization, and so this is an excerpt from one of their press conferences where they said an estimated 1 in 10 infections will result in long COVID, and noting that this will lead to hundreds of millions of people who will need longer-term care. One useful way of thinking about long COVID is to think of your personal risk of getting long COVID relative to the number of COVID infections that you've had. So this chart shows the cumulative risk based on the number of infections using 3 different probabilities. As I mentioned before, the World Health Organization has adopted 10% as their best estimate of the probability per infection. In the US, the Centers for Disease Control and Prevention, the CDC, have adopted a 20% probability. But even if we said let's conservatively go with 10%, you can kind of view this as Russian roulette. So at 0 infections, your risk is 0. At 2 infections, your risk is getting close to 20%. To get to a 50-50 probability, so 50% probability of long COVID only takes you between 6 and 7 infections. As I mentioned before, in Australia, there are a growing number of people who've had 3, 4, or 5 infections. And if we look at countries like the US and the UK, it's not uncommon for people to have had 7 or 8 or 9 infections. We also know that long COVID is affecting teachers. Kevin Bates, who's the Federal Secretary for the Australian Education Union, gave evidence to the Australian Parliamentary Inquiry into long COVID. And as part of his evidence, he noted that the AEU's members have experienced COVID infection multiple times, in some cases 4 and 5 repeat infections, and that they know from anecdotal evidence that repeat infections are common amongst teachers and are a cause for concern amongst their members. And if we look at data from New Zealand, this is some data that was obtained under Freedom of Information, and it looked at the prevalence of COVID infections by different occupational groups. And maybe not surprisingly, school teachers ranked number 1. We know that there are a growing number of school teachers who are suffering from long COVID here in Australia and worldwide. The prevalence of long COVID may not be obvious, and there are a number of reasons for this. And one of them, I think, is that teachers are often reluctant to disclose to their employers and to their colleagues that they believe they might be suffering from long COVID. And I want to make reference here to a study that was done recently in the US. It was a survey of over 1,000 school teachers, and what it found was that 84% of teachers who have long COVID had not told their supervisor, and 63% of teachers with long COVID haven't told any of their work colleagues. There are a number of reasons for this. They include the fear that this might impact on their employment and concerns about their future career prospects. We've talked about a wide range of long-term health impacts from COVID infection. They are and should be concerning, and it really doesn't make sense that as a society we're mostly treating COVID as if it were a much lesser health threat, like a cold or a flu, when objectively it's not. Here's a photo of Dr. Eduardo Balmaceda and Dr. Alberto Ortiz, 2 researchers at the University of Queensland, who are studying the effects of COVID in the brain. They are required to wear protective suits and full respiratory protection because COVID is classed as a biosafety level 3 biohazard. Just to explain what that categorization means, There are 4 biosafety levels with increasing risk from level 1 to level 4. COVID sits in BSL 3 alongside things like tuberculosis and malaria. And the only category above BSL 3 is BSL 4, which includes pathogens such as Ebola virus and Marburg virus. So this brings me to the precautionary principle. It's an extremely important concept, particularly when we're dealing with an emerging pandemic. We can paraphrase the precautionary principle by saying when facing threats that are serious and plausible, we should take action to minimize possible harm, even if we have imperfect information. In other words, it's better to be safe than sorry. We don't have the luxury of waiting for perfect information. We'll get better information and better research over time, but in the context of schools and COVID, it's better to take actions now, particularly when those actions cause little to no harm, but where those actions could prevent large numbers of children and school staff and their families developing long-term illnesses and disability or dying, rather than deciding not to take those actions now and instead hoping that everything will work out okay, despite the fact that there's mounting evidence that it may not.